One of our dentists in the Tulsa class last year came to class at the Coma session this year, about 2 weeks ago, and he said to me, Mr. Ellman, he says, I don't know whether I've made a discovery or not, but he says, it certainly works for me, and he says, I'd like to have you tell me what you think of it. He says, so many times I get artificial somnambulism. And I was getting artificial somnambulism to the point where I was just finding hypnosis, just taking my time, and I wasn't getting coma. And I wasn't getting deep somnambulism or anything. And he says, finally one day I decided to try something. I hit one of those artificial somnambulists who just couldn't forget the numbers, and I just, well, don't mind about that. And then I explained the coma technique to them. And I said, now I'm going to take you down to the basement of relaxation. And he says, I proceeded to do it. And he says, then without suggestions of any kind. Now remember, they were not in somnambulism when I did this. They were in artificial somnambulism when I did this. He says, I took them down to the coma. And without suggestions of any kind, I didn't have to say a word to them. I was able to do considerable dentistry of a very, very painful nature. Now, remember, they had no suggestion. They had this automatic anesthesia that you're talking about, and I was able to do my work. Well, I was so pleased when I made that one discovery. He says that I have been doing that ever since. Am I doing anything wrong? And I said, no, doctor, but you're doing something almost unbelievable. I can't believe that that's so, but if it is so, I'm going to have a couple of hundred doctors try it and see whether or not you've made an important discovery, because if you have shortened the hypnotic process considerably in getting them to the coma state. Now remember, here's what you do. Get the physical relaxation. Don't bother with the mental relaxation at all. Proceed to take them down to the coma from there and see what happens. And I think you will be delighted in many instances. I know you'll always be delighted where you've got somnambulism. It's just a shortcut. But he says that it works so beautifully you don't have to give suggestions of any kind, but can go ahead and do the most painful work. He says, I've done extractions this way. I've done so much that would ordinarily be too painful to do in somnambulism without a lot of suggestion. Doctor, you're one of our old students. Have you ever considered doing it this way? Have you ever?
Well, no, I'm not sure. The only one point I want to get cleared up, you're not talking about getting them into a better state in the coma, are you? Saying you're talking about the same coma state.
Yes.
Just circumventing the true somnambulism.
That's right.
Yeah, I've had that experience quite frequently in working with several OBs at a time, where I've had, especially if there have been some OBs who are a little resistant, as far as they come in, they know that this is hypnotism. They're not certain that they want any part of hypnotism. They'll get the physical relaxation, and they won't lose the numbers. Maybe there'll be 6 girls there, and 3 of them will, and 3 of them won't. Mm-hmm. So I've just gone ahead and ignored them because I had planned just to drop them out. Mm-hmm. As I went on down and diverted all my attention to these 3, mm-hmm. and just let the others, just let them go along for the ride, and then talk to them afterwards and tell them what they want to come back and try again. Since they've seen this, well, I'll be glad to have them come back. And I've been quite surprised to find that a lot of them will go down and do very well, and they definitely haven't hit a true somnambulism. They just, I think that I've been of the impression that once they start going for the basement, that they just automatically develop a true somnambulism, because they get that mental relaxation without ever hitting it before, just in the technique of going to the basement. And I would say I've had, I don't know, just guessing, this may not be anywhere near accurate, but I would say I've had at least 20 or 25 who have been in artificial and gone down into the coma state.
Well, this verifies pretty well what the man in dentistry had to say. It would surprise me if this were true in all cases, but it might be true in all cases. I don't know. I would want about several hundred doctors to report to me. Yes, doctor?
You might not like this particular idea, but I've had a couple of girls who I felt really needed hypnotism. I had a girl who had a Barkman abscess, which was a real bad one, and I tried to work with her before 6 or 8 months ago, and she completely rejected every part of it. So when she was on the examining table, I was going to have to drain it, and I told her that, well, just taking the cotton ball with the alcohol on it was very, very painful to her, just brushing it lightly. So I told her that we'd like to try this same thing again, and if she could get it, we could give her a lot of relief. And she was trying to cooperate with me, but she couldn't get the physical relaxation. However, when I'd have her open her eyes, she had the redness and the lacrimation and so on. So she had the signs there, but the physical relaxation wasn't there. And I've ignored the physical relaxation a couple of times and gone on into somnambulism and done nicely with somnambulism, which she did well with. In fact, we opened the doggone abscess and spread it with hemostats and so on and drained it. She felt no part of any of that and took real good post-hypnotic suggestions. And yet she had never actually had a physical relaxation.
Yes, Doctor, I've noticed that on several occasions myself, where I've been working with people, and I think to myself, they're not relaxed at all, and yet I'm able to get the somnambulism. And when that happens, I say to myself, now, what is there that we don't know about hypnosis that makes this possible? Because I swear to God, as a teacher, and as a man who's supposed to know probably as much about this as any man on earth, I don't know the answer to that one. But it has happened, and every time it happens, I'm so mystified, and I say to myself, if I could just get the answer to this. You know, time and time again, maybe this class hasn't heard me make the statement. Time and time again, I have made the statement that if there were certain things that I could explain, I would say that there's no such thing as hypnosis, that it's all a part of relaxation, and that hypnosis is just a phase of relaxation, and that there is no such thing per se as hypnosis, that it all depends on relaxation. But then you encounter a case like you have just mentioned, and it throws the theory so far out that you say, well, there's nothing I know that explains that situation. And so I cannot make the statement with any degree of certainty that I'm right, that hypnosis is just a part of relaxation, and that relaxation is really the word, and that hypnosis is just a word given to a phase of relaxation, and that hypnosis by itself does not exist, that it must be a form of relaxation. I think everybody in class can understand how I mean that. I don't deny the fact that there's such a thing as hypnosis, but it's a part of relaxation. Then we hit into your kind of case, and I can't explain it, and therefore I cannot make that statement.
On the other hand, I have seen a woman that could not produce eye closure, and we needed to do an operation on her. And after I stated, well, you can close your eyes, she just stared. And I said, well, let's go here and get on the chair and we'll do what we can with the local. Her eyes still remained absolutely wide open. Then I realized she was in a deep somnambulitic state. Never any closure, and this is the first time I've seen this one.
I've seen that, Doctor.
In a lot of respects. I don't know what state she was in, but then she was anesthetic.
I have seen that state, Doctor, and that is such a rarity. But nevertheless, it is encountered. It is encountered. And I'll tell you where you encounter it. See, when working with blind people, sometimes I've been called upon to hypnotize blind or deaf people. And when you're called upon to hypnotize a deaf person, you're pretty well lost if you don't maintain eye opening, just as we maintain eye closure in the usual case. And I have had to hypnotize with the eyes wide open and keep them wide open, and I've been able to get them into deeply somnambulistic states with the eyes wide open. Also working with blind people. My favorite method of working with blind people is to dissociate another group of muscles. For example, one of the most dramatic instances we ever had of that was where a man comes to the class at the time that I was conducting the classes in my own home in Passaic, New Jersey. And he brings with him a blind guest. These two boys had been pals from infancy. when the blind boy was about 4 years old. He had taken a tumble, a fall of some kind, and lost his eyesight. And these two wonderful kids remain friends even now that he was a grown-up man and in his 30s. Now, the blind man was brought to the hypnoanalysis session for this purpose. He didn't know if his knowledge of colors, if he remembered colors exactly. And so, because of the fact that a blind person resents getting eye closure, sometimes there's no eyes there, and they don't know what eye closure is, and it's difficult to get them. They're so sensitive about the eyes anyhow, that my method of hypnosis for a blind person is to just say, now, close your fist. I'm going to count to 3, and I want you to make it so tight, it just won't work. Now, 1, 2, 3, make it tight. Tighter, tighter, that's right. Now, when you just have it so tight that you can't open those fingers, try to make the fist work. It's the same thing as eye closure, except that I go to the fist for it. Then we were able to get him into a very deeply somnambulistic state, in which we took him back to the time when he was 2 years old, and 3 years old, and 4 years old, and things like that, and we let him see the carpet on the stairs. Well, the carpet on the stairs was red. So when he could see that clearly, he knew that he had red in focus. The grass was green, so he knew 2 colors. Then something else was yellow, and this fellow who was his pal, was able to tell me of various things that they had both seen together, so that the dentist could say, if we could get him to remember such and such, then he would know the color yellow. And by working with him for about, I think we worked with him for about an hour and a half, 2 hours, we were able pretty well to cover the gamut of colors. You can't cover every shade and tinge and hue and all that sort of thing. But for a blind person who had lost his memory of colors, this was a pretty remarkable thing to do, we thought. So the eye-opening is not an unknown state, Doctor. You can get him into deep somnambulism that way. And that occasionally it will occur without you're dissociating a special group of muscles, I can well believe, just as in the instance which you relate. However, it's not a familiar thing. Gentlemen, everybody here knows enough about hypnosis now to be able to do what we're talking about. Now, what you do is you get the physical relaxation and go right from there, right down to the coma. Forget the mental part of it. See whether or not that technique is successful for you. If it is successful, it means that the man in dentistry, or where time is so essential in his appointments, can get the coma. He ought to be able to get the coma in about 2.5 minutes. I mean, from the start, from an unconditioned subject down to the coma in 2.5 minutes, if that is possible. Dr.
I've had patients in the coma for oral surgery, and then as soon as I begin to work, I use the anesthesia, local anesthesia also, combined with the Coma State. And as soon as I begin to operate, they slip up. Why do they do that?
Because apparently you're giving the anesthesia unsettles them. If they have the anesthesia, why add anesthesia, Doctor? You don't have to add anesthesia to the coma state. You've got better anesthesia than your chemical anesthesia will ever give you.
I'm always afraid that they'll slip up.
They won't slip up, Doctor, if they've got it. The thing that gives them the unsureness and makes them slip up is the fact that once you give them the anesthesia, they think, oh boy, this is going to be really terrible because I've already got anesthesia. Why is he giving me this? He must be going to do something terrible. And it lessens their self-confidence. Fear creeps in, and then you lose the coma. Now, you do your work with a coma, and you'll find they won't slip up. Doctor, nobody's going to get out of a state which is so self-protecting as the coma state. Believe me, oral surgery can be awfully painful if you're taking we'll say an impaction through the roof of the mouth or something like that, doing what amounts to a very painful procedure.
On alveolectomy, where if you prepare the mouth for immediate dentures, I've extracted what many is called teeth and sealed down all the bones before for my dentures.
Yes, Doctor.
Mr. Herman, I've been doing a little bit in the last couple of weeks, and I've been changing my techniques around almost daily. But I started out with patients in a coma and giving them an anesthesia after they came up from the coma.
For what for?
Well, I just want to see what I could do. First, I didn't know if there's any practical application or not. But anyway, I had them come out, and then I would have them. One thing I was accomplishing was that each time I had them go to the basement, they could do it much faster. I started this on my OB to see what would happen. And then the next time they went to the basement, they'd go much faster. Their anesthesia wasn't nearly as good as it was with the anesthesia produced in sleep. However, when I would have them go to the basement 3 or 4 times, just one right after another, I could finally get an anesthesia which was equivalent to that which I could produce in sleep. It was very deep. In fact, they would have no motor function in particular extremities.
They don't know about this depth that you're talking about yet, Dr. Burpo, because they don't get that until the next session. But that work in sleep, in my estimation, that is the most unknown phase of hypnosis in the world. Very few people know that you can hypnotize in sleep, as you know. And the very fact that you can hypnotize in sleep and get into such nice contact with them in sleep and produce an anesthesia which is so delightful that you can then work with them post-hypnotically, and they don't even know from whence the anesthesia comes, but it's there. And you found the sleep state for administering anesthesia wonderful, isn't that correct?
Yeah, very much so.
Yeah.
Well, that was the point. On repeated trips to the basement, I could get the same depth of anesthesia, I'm sure. I've been trying the last couple of 3 days was to see if I could give them their anesthesia in the basement and then compound it in the waking state without going to the basement again. And I haven't been able to completely evaluate it yet, but the one place that I think that I've had one girl now who had a complaint about the dentist working in the coma state that she didn't want to have her eyes closed. That bothered her. So I put her in the coma state and gave her the anesthesia, and then we kept compounding it until she had all the anesthesia she needed, and then brought her out of the coma state and let her hang on to her anesthesia, and it took beautifully.
It's a very wonderful state, Doctor. You learn about it at the next session. Well, we've pretty well covered this. Has anybody made any mistakes or made any faux pas? Yes.
We've had a phone call today from a bleeder, and Dr. Waxman used a waking suggestion as we had talked about weeks ago, and it worked. We didn't have another call. He held on for 2 minutes, and she was a bleeder. He knew that already Thursday when he took the tooth out.
Yeah.
And then he found out the girl had to go to some kind of play tonight, and it was probably the anxiety that made the tooth. She let it out, and the tooth was bleeding again.
Yeah. Was it in this class? I don't think it was, but I think it was in the Kansas City class. Did a man, maybe it was here, I never can think what class that man belongs to. He had a tape recording of a bleeder that he had stopped at the hospital where the man was just gushing blood, and he'd heard the doctor say that, why, from a thing like that you could bleed to death. And he was bleeding, and he was really in terrible shape. And the doctor, using just waking hypnosis, he said, we can stop that instantly, and applied a swab with, he says, Mr. Ellman, there was nothing on that swab. He said, I just applied the swab and said, now he'd stopped bleeding. All right, gentlemen, in getting started on today's session, there's something that I want to hit awfully hard before we start, and that is the use of these relaxation records. But if there's a doctor here who has used these relaxation records, he knows how valuable they are. If he hasn't used them, he has no idea how valuable they are. When you get to using these relaxation records for their real purpose is to condition for delivery. That's one thing. The second purpose is to take the difficult patient, the patient with whom you cannot work in hypnosis, and teach them how to relax so that you can work with them in hypnosis. And if you have used the records at all, give those to the patients who get artificial somnambulism. Let them come back a week later and notice how many of those people will have developed true somnambulism just because they've listened to the record. This record is as potent as the OB record, the OB conditioning record. And women have delivered babies just by listening to that record alone and nothing else. And I think that every man here should use the relaxation records which we gave you, and should make use of them to such good extent, and be able to give them out to his patients. Give them out to your patients. Make them pay you for them. God knows you have to pay for them, so they have to pay for them, just like I have to pay for them. But do use them. If you don't use them, you're losing something very important out of this course. And that's not said so that you buy relaxation records. It is said so that you will use relaxation records. You've got two with which to test. One is for yourself, one is for your patient. Try it on a patient, and you'll be surprised. In most instances, you'll come back and say, hey, look, I better have me some of those things around the office. And when I tell you that I've had doctors who have ordered 100 of them at a time, and even 150 of them at a time. That's the highest order I ever received for them, was 150 from one doctor, but that'll give you an idea as to their value. Gentlemen, today we're going to start by telling you some of the ways in which hypnosis can be used in sexual problems to your advantage and to the advantage of the patient. And in talking about these things, I want to first rule out all organic pathology. For while it is true that if organic pathology is present, still in all, much of what I say will remain true. But because some of it will not remain true, I'd rather have you say, look, forget all organic pathology now, and then everything that I say is absolutely so, and you can depend on it 100%. We have been teaching this subject about a year when an industrial physician in one of our classes came to class one night and said, you know, I relieved 2 cases of impotence within the past 24 hours. And the doctors, of course, began to kid him, how do you know, and so on. And he said, well, let me tell you what happened. He said, there'd been an accident, and I was binding the lesions of one of the men, and it finished, and he was leaving the office when he said, I wish you could fix my real trouble as easily as you fixed this. So I said to him, what is your real trouble? And he said to me, well, my real trouble is just this, that when I'd been married 10 years, I took my first vacation away from my wife. I went down to Florida and played around a little bit. As a result, got a venereal disease. I had sense enough to go to a good doctor, and with your miracle drugs, he was able to help me in just a few days. And he pronounced me cured, but I had such a feeling of dirt, such a feeling of guilt, that I just couldn't return home to Jersey. And I stayed in Florida 10 weeks after the doctor pronounced me cured before I finally had nerve enough to come home. He says, finally I came home and tried to resume family relations, and doctor, I couldn't, and I've been unable to ever since, and that's been about 5 years ago. I want you to notice that in this case, the cause was known at conscious level. The doctor put him into deep somnambulism, gave him the suggestion that he punished himself long enough for his misdoing, that in punishing himself he was also punishing his wife, and there was no need for it, and that he could stop punishing himself now, and that night he would be able to resume family relations and he'd never be impotent again. He gave him the suggestion also that he would have the potency, henceforth, of a 15-year-old boy. I'll never forget that, because we laughed so much at that line of his. Well, anyhow, the result was that the following day, the man came in bringing another man from the plant. And he said to the doctor, Doctor, it worked so well for me, maybe you can help my friend here. He says he's got the same problem. So the doctor said, what's the matter with you? And he says, well, when I was 45, I married a girl of 21. On our wedding night, the fellas began to kid me that I was an old buck and could never make good with a girl of 21. And I haven't been able to make good, Doctor. We've been married for several years now, and we've never been able to consummate our marriage. Here again, the cause being known at conscious level, the doctor put the man into deep somnambulism and gave him the suggestion that he would be able to consummate his marriage that night and henceforth would have the potency of a 15-year-old boy. Gave him a good deal of assurance and so on, with the result that the 2 cases of impotence were relieved within 24 hours, just as the doctor had said. Now, that night, the doctors began saying, well, now, look, Dave, what do you know about its use for things like impotence and things like that? And I said, well, my knowledge is limited. After all, I've used it on people in show business to help them out, but only on a friendly basis, and I'm unable to tell you very much about it. I do know that the books have been saying for 100 years or more that hypnosis is very useful in solving things like impotence, and I have no doubt but what you'll find it very valuable in quite a number of instances. And so, when I told him, why don't you go ahead and try it? This course has always been more the favorite of MDs than of the DDSs, and there were all MDs in that class, and they all began using it on their cases, with the result that I'd get telephone calls like this after about a month or so. Dave, it worked in the first 2 cases I tried it on, but the third one I tried it on, he's just as impotent as ever. I didn't help him a bit. Would you come over and see whether or not you can help me with this case? Well, I didn't know what to do any more than they knew what to do at the start. But it occurred to me that every case we were successful on was easy to analyze. Every case that we were successful on, the man knew the cause of his impotence. It would be like that man who married the 21-year-old girl. It would be like that man who went to Florida. He knew the cause. And wherever we were successful, they knew the cause. But where we weren't successful was when a man would come in and say, I don't know what makes me impotent, but I am. There were the cases that we failed on. So I said, if there's only one thing to do, seems to me, if we put them into hypnoanalysis, maybe I can find out the cause of their impotence. And if I could find out the cause of their impotence, then they'd be like those other men who knew the causes, and maybe then suggestion would work. This was not such a great rationale, it was common sense. And it worked. Oh, brother, how it worked. These cases where they were not successful on, once you did hypnoanalysis and determined the cause of the impotence, they were just like the others. They responded to suggestion immediately. Now, I began to be called in by so many doctors for this type of case that, honestly, from morning until night, I was busy solving sexual problems with the use of hypnosis. And I think I can honestly say that I have handled as many of these cases as almost any doctor on earth. I don't know of anyone who can say that his cases have run into the thousands as mine have run into. And each time they were worked on in the doctor's offices, and I used to be able to say, in fact, old students have heard me say that I have never failed with an impotence case. And that was true until just a few months ago, and then I came a cropper. I've worked with over 1,000 impotence cases, and have never failed, and I think the reason that I never failed was that I kept on working with them until I solved the problem. That may be the reason that I never failed. Anyhow, about 2 months ago, a man asked me to help him, one of the doctors in one of my classes, and I tried my darndest to help him. I could get him rid of a lot of neurotic disturbances, but so far I have been absolutely a flop. However, I do have an appointment with him again during the course of travel in the next couple of weeks, and I hope to be able to solve it then, because I'm very proud of that 100% record, and I don't want it to be less than 100%. I know it doesn't have to be less than 100%.